Over the last 24 hours, we identified 442 new cases of COVID-19 and completed about 7,700 tests. Our positivity rate was about 6%. There are currently active alerts or outbreaks in 242 schools. Of these, 2 schools had 10 or more COVID cases who attended in the last 14 days while infectious. There are currently 836 people being treated for COVID-19 in hospital, including 183 in the ICU. Sadly, over the last 24 hours, 12 new deaths have been reported to Alberta Health. My thoughts are with the family and friends of these individuals. Their deaths are a painful reminder of the serious outcomes this virus can cause for people of many different ages, backgrounds, and health conditions. It's clear that we will not be able to eliminate COVID-19 either in Alberta or around the world, so we will need to learn to live with COVID-19. Anyone who is not fully vaccinated is almost certain to be exposed to COVID-19 at some point in the future if they haven't already been. And so it's another reason why for those who haven't been exposed yet, now is the perfect time to get the protection that vaccine offers. How that will look in terms of the timing of infections or how quickly those infections are grouped together will really depend, again, on how we work together as a province. It's why we continue to have public health measures in place, because our acute care system is continuing to be under significant strain, even as our numbers come down. We're sitting at about the same number of COVID patients in ICU right now as we had at the absolute peak of our 3rd wave. So even though it's encouraging to see numbers decline, again, that's why we're really needing to focus on protecting each other, both through vaccine and measures, and what a 5th wave might look like or how COVID will unfold in the future. Again, depends on multiple factors, including how many of us take the advantage of vaccine protection, including whether or not there are different genetic variants that emerge of COVID and how that interacts with the vaccine. So as we have always done, we will remain vigilant and watch the evidence and respond accordingly wherever there are needs to adjust our approach. It's encouraging to see that the numbers have continued to decline. There is one small caveat, I'd say, that we know that any kind of significant event like Thanksgiving causes 2 kinds of challenges. So the first is the transmission that might occur on that long weekend specifically, and we're definitely past the time where we would see that direct impact of Thanksgiving. But what happens in a secondary way is that if there are significant spreading events on that particular date or on that weekend, it could potentially cross into multiple networks. And so sometimes we see a secondary impact. And right now we're kind of at that point in time where we're monitoring for that secondary impact. Again, encouraging to see our positivity rates continuing to decline. However, it's still really important to keep vigilant, to celebrate that we haven't seen a significant bump so far, but ultimately we know there's still a lot of COVID out there and we do need to maintain caution still.